Welcome to Minor Specialty, a podcast for nurses who want a clearer view of what's possible in this profession. Real nurses, real stories, and real possibilities. Hi, everyone, and welcome to Minor Specialty Podcast. I'm your host, Rebecca Emery, and today I am joined with a nurse that we'll be talking with about what her specialty is. So if you wouldn't mind, if you can introduce yourself and talk about what is your specialty.
Hi, so my name is Jaclyn McPheeters. I am in critical care nursing. I am currently a board certified family nurse practitioner. I have over 15 years of experience just spanning across critical care setting. And then currently I am working in a skilled nursing facility as a family nurse practitioner. I do have a background in internal medicine. I've done primary care with that, and I've done skilled facility. I've taught previously in med-surg nursing, and then with a focus in critical care and then capstone for BSN students. But critical care background, I know, is what we're kind of focusing in on today. So yeah.
The life of a nurse for sure, right? And
Yeah.
all the avenues
Yes.
you can do and deciding where to go. And part of this reason for this podcast is to show nurses where you can go with the exposure, because in nursing school, we only get 4, maybe 5 specialties that we're exposed to. And how are you going to find out all that's available to you? So that's what this podcast is actually meant to do, is to show a nurse all the pathways. So thank you for sharing all of that. So tell me though, so we're special, the ICU, right? Is that,
Uh,
and stands for, because I'm going to put it out there for,
Well, it's intensive care nursing, so critical care nursing. There's different types of critical care areas. So even within critical care in itself, you could actually be super specialized. So I've always worked in what's called medical ICUs, but there's also cardiovascular ICUs, so heart patients. There's also surgical ICUs, so surgical patients. There's neuro ICU. So even within critical care, you could be hyper specialized even beyond just that. So within a medical ICU, which is where I basically lived before I became a nurse practitioner, I seen actually a little bit of everything. You dealt with patients with just super complex conditions. So a lot of patients with sepsis, a lot of patients, you get like the overflow from like the cardiac area. I feel like half the population has cardiac issues. So you do deal with like different shock states, like so cardiogenic shock and so forth. So you do see a little bit of everything. I personally worked in 3 different facilities as a critical care nurse. So I worked in 2 community type hospitals. And then I actually worked in a tertiary center in medical ICU. So even like the level of acuity of what those facilities will see is very different. Like the job, even within that, is just very different based off the acuity. The people are very, very sick in all facilities. And if you're in an ICU setting, because what does that mean? When you're in critical care, you're going to critical care for expert nursing. That's what you're there for. It's usually a 1-to-1 ratio for a patient, a 2-to-1 ratio for a patient. Very seldom is there a 3-to-1 ratio. And I think that when people hear that, they might automatically think, ooh, that's easier than maybe like floor nursing where you're having 5, 6 plus patients, right? But what you have to understand is the patients that you're being assigned are so medically complex. You're not like leaving the room. Like those patients are trying to die. So your role is to literally have that like adrenaline rush through you as a person, and you are actively titrating drips to different parameters. And this can happen every like 3 minutes where you're changing a medication, doing medication dosage adjustments on not one drip, but multiple drips. You have patients that are on ventilators with either endotracheal tubes or tracheostomy tubes, a lot of advanced lines. So it's not just traditional IV lines. You have different types of central line access. Sometimes patients are having central line access plus maybe dialysis access. Maybe they're on continuous dialysis. that you as the nurse are also doing continuous like hourly intake and output and making adjustments on a dialysis machine just to keep the patient at a normal like fluid balance, whatever their parameters are set for. Just because you have a smaller ratio of patients, it is very intensive, hence intensive care nursing. It's very intensive nursing. So when you're going into a critical care setting, it's because you need that expert nursing care. So there is a lot of technical things that you have to master and learn and be very comfortable with compared to like working in a med surg ward or even a telemetry floor.
Yeah, that sounds like, I'm glad you talked about that with the 1-to-1 being the
Mhm.
ratio, which can be attractive to a lot of nurses. And I do, I coach a lot of nurses, and I'll always start with like, where do you want to go? And a lot of them will say ICU. And I think it's what they're exposed to early on, thinking, okay, I want to do that. So I'm glad that you are talking about that.
Yeah. So when you're working as a nurse in critical care, this is at least how my brain would operate, right? Like it's as you become, going from a novice, which I actually started in ICU, to what I would say expert level, when you go through that novice to being proficient, to being, competent, and then becoming like expert, you actually like really in depth from getting shift report, like you understand your patient in a very deep way. What I mean by that is, gosh, after my first year, like if you could ask me my patients, I could like in essence recite what their CBC says, like verbatim. Like their hemoglobin's 8.9 right now. Their white blood cell count is 13,000. You could actually like from memory go through it because you actually learn your patient very, very deeply to actually know how to take care of them and then anticipate all of the different things of what is maybe going to go wrong with that patient during that shift. It's kind of like playing chess. You have to try to anticipate worst case scenarios and different things that might happen during the course of the shift. So it's a very dynamic practice, really. And everything can just change on a dime. And it does change on a dime. 1 hour your patient appears to be stable. The next hour they're coding. The next hour they're fine again. The next hour, like it's just very tenuous.
So it sounds like you have to stay a step ahead, and like what you're talking about, anticipating what
Yes.
can happen in a shift.
Yes. So it definitely takes a great deal of critical thinking when you're working in critical care. So yeah, you have to, in order to really take care of these patients, you just have to always be thinking like one step ahead and trying to plan for the worst and wishing for the best kind of thing.
How did you get into this?
So I actually was a CNA. I worked on a telemetry unit and I was actually pulled to the ICU when I was working the telemetry unit. I actually didn't like the telemetry unit that I was on very much. But I actually had a situation in which there was a 25-year-old male that was a heroin overdose that coded multiple times during that shift. And I was a CNA there, pulled to that unit. And honestly, being part of that experience, which was horrific, it was very emotional. It was horrific, and the patient did expire. But like being part of that team process and seeing how those nurses, I was just so impressed. I'm like, wow, like this is what I want to be. Like, this is what I want to strive for. Their level of teamwork, their level of critical thinking. It was just like clockwork. Like they just worked together so in sync. And I was just like, I want to be part of this team. So the very next day, I actually put in for a transfer. So I went there into ICU as a CNA, which was great exposure just to see, hey, if this is actually what I'd like to do. And I learned a lot of things working as a CNA through nursing school. And I did a nurse externship over the summer where I was worked as a, nurse extern in that ICU that I had also been employed in. And that was great exposure over like the course of the summer. And then essentially when I graduated, I applied for a job in that same ICU and I was hired on as a new graduate. So that's how that came to be. I never think that I don't know that I would have ever necessarily, if I didn't have that experience, like chosen to go that route. I didn't even really know that that route existed or what that looked like. But I mean, I really loved it. It's a very hard and taxing job, especially like emotionally. Like I would be lying if I didn't tell you that I had countless times where I literally would just get into my car after 12, 13 at plus hour shift and I would just bawl my eyes out because you would have 25-year-olds that died during your shift and it is tragic and you're supporting that family and it's just incredibly emotional and sad. So that kind of brings me to talking about what I would say is probably the hardest part of the job, and I think that is having that emotional resilience. I, as a within the first year or two of NICU nurse, I actually almost quit like several times, like almost every shift. I feel like it was a lot, and I would be lying if I didn't say that I was overwhelmed. I did seek professional help to like process some of the things that I was seeing. And I do think that I actually experienced PTSD during that transition as an RN. I do think that it's a very emotionally hard job and it's definitely not for the faint of heart. But I think that if you learn the coping skills that to really survive in that field, I do think that it is a beautiful thing. And I do think it's a very rewarding career, especially if you enjoy really getting to know your patients very, very deeply and you enjoy like learning like analytical skills because that's very much needed to succeed and to be good at that type of nursing.
Thank you for sharing that.
Yeah.
Do you know if like hospitals offer those kind of resources for nurses in these specialties?
I think every hospital system I have ever been in, yeah, they have some sort of like employee therapy that they do offer to help nurses with that. I do think that working in a good, healthy ICU environment, there's a lot to be said about having a good nurse leader. I think that that's like paramount to like your happiness is really having a leader that understands what it is like a day in the life and understands that emotional toll. Like I've had great leaders, I've had also not so great leaders functioning through the unit. And the whole way that the unit feels is very different depending on the type of nurse leader that a person has.
Yeah, and it's important. I mean, we are human. We do thrive in areas, but yes, you're going to have those days that are hard and learning those skills. And yeah, my hope was yes, that hospitals do offer this for nurses. I know a lot happens with as far as debriefing too. You're
Yeah.
saying that, yeah, and having that leader that recognizes the need for doing that.
Yes. So I know we're not going to kind of speak very strongly into this necessarily today, but in part of like my ICU role, I was also on the code team and rapid response team. And debriefing is a very big piece of that, especially for floor nurses that they don't get codes necessarily all the time as you do maybe in an ICU setting. So it can really impact them emotionally. So I'm also becoming good at debriefing and doing a check-in to make sure that the staff is okay is really a big piece of that too.
What is the most rewarding part of being in the ICU in the medical
Um,
setting?
Gosh, seeing patients get better. There are a lot of patients that don't make it, but there's also a lot of patients that do. And that's like super rewarding when you work over the course of a week and the patient that you cared for on a Monday by Friday is maybe extubated without like a breathing tube and maybe has been weaned off all of the drips that they're on and are maybe sitting in a chair and actually like transferring out of the unit. And that's a super rewarding experience because you actually get to see them do well. So I think that's rewarding, especially like I mentioned I was part of medical IC, like that's where I kind of lived. There was a lot of overflow. I would say that being in a community setting, you had like a lot of different mixes in there too. So you'd see like the surgical patients, which oftentimes would do very well. So that was like a rewarding experience. Like they're sick, but it's most of them did get better that you would see, especially for like some of the more complex, like elective, maybe like lung surgeries and stuff like that. So that's very rewarding. And then I actually think like that I really enjoy being part of really good, like healthy team dynamics. Like when you work in a healthy ICU environment, you're almost like you feel like you're with a second family where you feel like you're amongst friends. And you do need that teamwork to literally survive and for that unit to thrive. You maybe have literally patients that are crashing and you have, 6 nurses in the room, each doing something. Like it's just like complex. And I actually really enjoyed that. And I've always worked with like, honestly, the best nurses. I've been like so blessed, like best nurses that you could have ever in all environments like work with. So I loved that piece of it.
Yeah, that's definitely another part of your nursing experience is who you're working with and knowing that
Mhm.
you rely on them, right?
Yes.
So you started in a pathway where, you started as an aide and went over there, but if someone's never been over there, but this podcast, let's say, resonates with them and thinking that's, the kind of nurse I want to be, what recommendation would you give them?
Yeah. So I actually always recommend job shadowing. I think that honestly, most unit managers are probably pretty open to that, even if it's for a couple hours during a shift. So even as a student, you might be able to try to reach out to a nurse manager or say, like, hey, I'm super interested in this area and I want to see if this is like the right fit for me. Can I do some, job shadowing of some kind? And I actually think that that's important too for people that are new with their registered nurse license and maybe even work in an area and you're thinking of transitioning out of another area into that. I think that it's good to like job shadow even for a shift before accepting a position because with honestly anything, I think that like it's across the board, not just ICU, just to see if you think that you would like it and if the culture of the unit feels good, like if you get that like good gut instinct about working at a place, I think that's like super important. I do think that if there's an externship available, I think that's an amazing route too, because you're being paid to have like an extra
Very
clinical experience. Yeah. Under your belt. And if anything, if even if you didn't like it at the end of the day, it's a great resume booster. It's a stepping stone. So, yeah.
right, and avenues to maybe the other areas that you may have considered.
Mhm. Mhm.
Oh, okay. But like you started right off the bat as a new grad.
I did.
What, looking back on that, is that something you would do again, or great that it worked out that way? Or what would you tell a nurse that is
Uh,
brand new?
So, personally, I think that if that is what you want to do it. Get the training. Like most places have a very great onboarding. If it's a good, hospital facility, it's usually a longer onboarding because there's so many different things that you do have to learn. So, onboarding should be anywhere from like 2 at minimum to 3+ months for a critical care nurse. It is a lot of orientation, and it's meant to be that way for patient safety because there's so many different things you have to learn. You do need to know how to be very comfortable and I would say like competent level for reading EKG strips, which I think for some nurses is seems to be like just more of a challenging skill, especially straight out of school, because they don't necessarily hyper focus on all the nuances that you do need to know to safely care for patients. Taking some sort of advanced telemetry course that would be very beneficial. I know for working in healthcare, you have to be BLS certified. In ICU, you have to be advanced life support certified or ACLS. So that is actually a great course to take if you're looking to get into this. As you advance in critical care, you can actually also get a certification, which is another board certification, and that's called a critical care nurse, like CCRN.
Mhm.
There's actually an association for critical care nursing, which is like, in my opinion, which I'm a little biased, like the best association ever. But you could, as there's different criteria. You can't go from being, a registered nurse to then studying and taking like a CCR on board. There is which I don't recollect what the criteria is off the top of, but
Usually
it's,
hours, I know for like all the board certifications, you have to have so many hours in that specialty and it translates to years that,
yes,
you before
it
you
might
sit
be,
for that.
don't quote me on it. It might be three. I don't recollect off the top of my head, but you have to meet criteria. But even studying for that board, you learn so much. So I've taken 3 boards since I have become a nurse. I was like, my registered nurse, my CCRN, which I no longer hold just because I'm not in that environment. Like an
Right.
alumnus is what it's called, CCRN alumnus,
Okay.
and my family nurse practitioner degree. And honestly, out of all the boards that I took, I actually think that that was the most difficult that I took. So,
Oh, wow. Yeah,
yeah,
I can see that probably, but I'm glad you brought up the organization because that is a good way for nurses to see what, the articles that they're putting out that are good articles about the specialty and what's happening and keeping up with, all the changes that happen in healthcare because things get
yeah,
changed on how we sometimes treat a patient that finding out that this is actually better, the data shows. So those are good to be. And I also know that they offer discounts for students. So if there's a student that's on here listening to us today, they usually can get a discount for membership. Is that correct? And in what you're
yes, yes. And just also to students, one thing that I wish is just as a pro wisdom that I wish I maybe was taught from a mentor before, local facilities will pay for some sort of continuing education. Like they want to invest in you. Like a good employer wants to invest in their employees. So let them invest in you. Most places do have some sort of continuing education stipend, even for registered nurses. And even if they don't, I actually think ask anyhow. Ask your nurse
right.
to invest in you to retain you because honestly, like if they want to be the best in medicine for their patients, like you best invest in your nurses.
Yeah, no, I agree. Yeah, thank you for bringing that up too, because a lot of
Mhm,
nurses don't know that their
mhm.
organization offers it and they end up paying on their own. And even if you do pay on your own and you found out afterwards, you can get reimbursed. So take advantage of that. But it's better if you ask ahead of time. And then you're right. If they don't know and they take a course and they can take it to their employer and say, hey, this is for here my growth as a nurse here in this unit, please can I put this for reimbursement to get paid?
Yes, definitely asking about that for sure.
Okay, great. All great information. Thank you. And so anything else you want to add? I do want to talk about growth. We kind of touched on it a little bit, but lateral growth from going from MICU to growth that you can grow in from being in this specialty.
Yeah, so I think that it's kind of a mixed bag. I don't know like statistics or what like if you were to, Google search what data says. Nursing, so in critical care nursing, the reality is, and I think it does go back to the emotional impact that it definitely can take a toll. You see different things. Okay. So it does have a high rate of turnover, meaning like maybe people will do it for a year or two, but they get burnt out too quickly. I do think that it has maybe like if I'm not mistaken, again, I don't know what the actual stat is, probably a quarter of people maybe work there a year or two and then burn out, where they need to switch just because it is too intensive to sustain them and their work life balance and what they're kind of bringing home emotional baggage and so forth. There is a lot of opportunity, I think, for growth. You could be like a charge nurse, which is treated differently depending on the organization. So it's type of like a manager position, more or less. So you can go into management. You can be a clinical nurse leader over that type of area. So I think like definitely moving up in that way. I think that the level of autonomy and the confidence and the skill set that you gain from being a critical care nurse, I think that it makes for great, like, organizational leaders where they can really, analyze and critically think through very complex problems and organizational needs. So, like, I think, like, leadership opportunities even beyond the walls of, like, an ICU setting, I think that they make fabulous leaders, because of that. I think a lot of nurses in critical care, they have this, like, quench for wanting to know and learn. I think on for advanced degrees, whether that be in a nurse practitioner role or maybe like a nurse anesthesiology type of role, just because you are dealing with a lot of advanced airways, you're dealing with a lot of ventilators and drips and sedation titrations and so forth. So it's, I don't want to use the words, but like a transition point where some
Like a
people
good
might
lead,
want.
a lead way. Yes.
Yes, it's where, like, they have that experience, and it just feels, like, natural to grow in that way. So, like, for kinda talking through myself, I chose to be a family nurse practitioner because I wanted to be more preventative, help the patients to not end up in an ICU setting, and I wanna learn how to best manage chronic conditions and how do we catch these things before they end up in this, like, horrible state, right?
Mhm.
So that's why I entered into primary care, and, currently, like I mentioned, I'm like an in-house NP in a skilled facility, and the facility that I'm in is unique in that I actually manage trach and vent patients within the facility that I'm in. They also take non-titratable drips, and I feel like I am very good at it because it just all kind of blends together and it just flows like in that way, like where I've had that exposure. So there's so many different avenues that you can take in nursing. And that's like the beauty of the profession is you're, you have your degree, but it is nothing is like set in stone, right? Like it is a very, I'm gonna use the word flexible, where you can experience different things and see just what feels right to you and like where you're going to grow with passion and what's going to make you happy and how you're best going to serve patients is when you're happy, I feel like. But yeah, there's just so many different things. Like I have a lot of nurse colleagues that are maybe in like case management now, or even like kind of beyond the bedside type things. Yeah.
Right. I mean, what we're talking about actually is like feedback. Like every time you take a role and you get the experience, that's feedback for you on what you like and where you're going to grow. And we know a lot of nurses that want to go even to be an NP. And it's great that you're mentioning that the experience that you had kind of took you more down that road. And so you had a strategy of, this is great what I'm doing, but maybe I'd rather be in that prevention part of it. Let me get my NP and
Hmm.
do that. And then you took all that experience with you of what you did over in the critical care setting. I have a question for you, just kind of a fun way to end it and say, my nurse specialty is perfect for the nurse who is.
Has a big heart and has like a want to learn. So always looking to learn. That's probably, like, the biggest thing in critical care to be successful, you do have to be willing to and wanting to learn just because it's constantly changing, like how you mentioned before, like, just the practice of nursing is constantly evolving, constantly changing, and actually, it's fun, like, that's what it should be. It's, "Oh, how can I apply this knowledge and really, like, take best care of the patient and elevate the care for the patient and actually, like, save the patient because you have applied the nursing process in an elevated way.
Right. Yes.
It is a difficult environment also, but it's a very rewarding environment. Can definitely make a super huge impact for your patients, and you literally can save a life.
Yes, for sure. And then if you choose to grow from there, you've got all that experience that you've had in those years of working in the critical area. So, for nurses listening, I hope this episode gave you a better look into the specialty. We'll put the how to get you in the show notes.
Okay, thank you so much. Thank you for having me.
Thank you. I hope what you heard today gave you real insight into the specialty. and help you see what's possible for your nursing path. Please subscribe so you don't miss what's next. And tell me, what specialty should we feature next? If you're a nurse in a unique specialty that you'd love to share, apply to be a guest on my website. I'm Coach Rebecca. Until next time, keep exploring.